Good afternoon. Thank you so much for joining us at this National Centre for Family Hubs hosted bite-sized training on integrated care systems and family hubs. My name's Julia Mays. I'm the Program Manager in the National Centre for Family Hubs here at the Anna Freud Centre. The National Centre for Family Hubs is an online resource hub and learning network funded by the Department for Education and led by the Anna Freud Centre, the UK's leading evidence-based children and families mental health charity. We're here to support the development of family hubs and to spread best practice across England, taking into account what families say they want and need, what providers tell us about best practice, and what we know from evidence about what works. Today's bite-sized training session is the second in a series of bite-sized training sessions that will be running as part of the National Centre for Family Hubs Learning Event Programme. If you're interested in any of our previous learning events, recordings and resources from all of the events in the programme are available on our website. We have our next bite-sized training event happening on the 15th of June as part of Infant Mental Health Awareness Week, and you can sign up for this via our website. You can also register for our next National Centre for Family Hubs conference, which was going to take place in July, but has now been postponed to the 8th of September. So we'll share a link to our event registration page in the chat now for anyone who's interested in joining us. And you can also sign up to our Family Hubs in Mind Learning Network to receive our newsletter where we share all the details of future learning events and other resources. Today's session will be recorded and will be available to watch back on our website in the coming weeks. All of the slides will be sent out in a follow-up email to delegates after the webinar and shared via our website. The chat function has been disabled today, but please do submit any questions or comments via the Q&A function. There'll be some time to explore your questions following the presentation this afternoon. Closed captions are enabled for the webinar, so if you'd like to enable these, please click on the closed caption button at the bottom of your screen. We're very pleased to have Andrea King joining us here this afternoon. Andrea is the Director of the Clinical Division here at the Anna Freud Centre. And Andrea has worked in the public sector for over 20 years, specialising in children's service multi-professional system transformation across the voluntary sector, central government, and as a senior leader in local authority. Most recently, Andrea oversaw the children and young people's mental health transformation and improvement in the South East region for NHS England and Improvement, and provided a pan-regional national leadership on vulnerable children's access to mental health support. And as part of her role here at the Anna Freud Centre, Andrea has been working with system leaders across health and children's services to ensure that investment remains focused on children as integrated care systems develop. And we've been asked to provide support to directors of children's services and the health economy to help people think about how these two things fit together, integrated care systems and family hubs. So thank you so much for joining us this afternoon, Andrea. I'm going to hand over to you now.
Thanks, Julia. That's a lovely welcome. And lovely to see everybody here today. Thanks for joining us just before the long bank holiday weekend. I'm sure we've all got other things pending on the horizon of our view. So it's really, really lovely that we could be together. I should just say I'm just recovering from pneumonia, very unfortunately. So you'll hear it in my voice. And every now and again, I'm just going to have to stop and cough. So I apologise for that. But I hope that our time together will still be a really good time of discussion and thinking. So let's start with a little bit of an introduction to, okay, so what are these integrated care systems and how do they fit together with what we're trying to do around family hubs? So next slide, please. Thanks, Rachel. So we'll cover a few things today. We've got about 45 minutes of talking in this way, and then we'll be picking up questions and answers. So why are integrated care systems so important? These new statutory bodies in the health economy that encompass all of our health economy and local authority leadership to transform the system for children, young people, and also for adults. We'll think a little bit about what's the formation of these ICSs, what's their focus. We'll also say, okay, so in the past, these arrangements have tended to be quite adult focused and in many ways older adult focused. How do we move and support that transition to a focus on children, young people and families? We'll also give you some kind of basic tips and some guidance on what could be helpful. So key questions that you might want to ask when you're in these conversations with colleagues across the professional system. And then we'll think about, what does the evidence show us? We're just going to pick out a few highlights from the material that we would normally work through with integrated care system leaders, local authority leaders and partners in the conversation about this. So we'll just give you a few highlights. And if you want more of that kind of help and support, do come back to us. So let's move to our next slide. Just by way of introduction, I'll say a little bit about who we are at the Anna Freud Centre and what we do. Many of you will know us well for hosting the National Centre for Family Hubs, but it's important to recognise there's a whole host of other stuff that we also do. So we are the leading centre in the UK for children and young people's mental health. And that means we offer an awful lot of training to a whole range of professionals in the workforce in mental health related, emotional health related CPD and development. We also provide a whole range of specific support for local authority colleagues, everything from trauma support, particularly for children in child protection and children in care, post-adoption as well. We offer very specific support for early years settings, particularly with early years resources. And we also offer a whole set of very specific support resources and services for complex adolescents who are going through quite challenging times and are often the most in need. And that's all in addition to hosting the National Centre for Family Hubs. So for those areas that invite us in and say, could you help us to think together as partnership leaders about integrated care systems and transformation together? That's what we're bringing with us. So next slide, please, Rachel. For Family Hubs specifically, we've talked a lot about how we need to think very carefully about strategic transformation and change, what that might look like. And that starts with building an understanding of what is the consensus of the need. Where are the foremost gaps? Where are the foremost risks? How together might we respond to those? And that's a dialogue with our children, young people, our communities, our frontline multi-professional staff and our senior leaders. In order to make best use of this really precious resource, we need to start with asking those questions. We've then also provided a lot of help around building a theory of change. So actually, what might the options be for what family hubs look like? And then planning that theory of change, that kind of how do we do this step by step, strategically, operationally, and relationally with each other and with our children, young people and families. How are we going to do this best together? So this webinar kind of really takes that context into account. Next slide, please, Rachel. So you'll be very familiar that every month, pretty much, we've produced more modules and more guidance for you all in local systems to help you with each aspect of that thinking. And this is the next iteration in some of that content to help and support you. Here are some of the examples that you'll be quite familiar with. You can find all of these online, freely available to everybody. Please do go and have a look, pick them up, take a look at them and use them. Next slide, please, Rachel. So now we're going to think about, okay, so in the context of Family Hub strategic development, operational planning, in this design with our communities and with our partners, how are we going to take account of what's happening with the fairly big changes in integrated care systems in our sub-regional and regional levels? How do we bring these two things together? Next slide, please, Rachel. So there's a few things just to say right from the outset that are important. We're not entering into Family Hub system design, strategic transformation with a blank sheet in front of us. We're not entering into it with a consistent environment around us. Everything is a system of moving parts at the moment. Our system is not neutral. There are key aspects of transformation and change happening all around us for children and young people at the same time as we're wanting to design and develop family hubs that respond to the needs of your children, young people and families at your local level, with an eye to what is it that they must do, what is it that they must deliver. We need these two things to come together coherently. Otherwise, our children and young people will find themselves really muddied in what's happening. We might end up developing competing offers. We might end up with gaps in our offers that none of us have responded to. So that open dialogue with integrated care systems from the start is really important, because a lot of that transformation is happening in an integrated care space. For our workforce too, this matters. Whether you're in the voluntary and community sector, you're in a statutory service, whether that be local authority, health economy, the police and criminal justice, you name it, this system is changing around you and asking you to adapt as a professional or as a volunteer. Making sense of the system for our frontline staff and our operational managers is really very important. So what I'm asking us to do before we begin the design work is stop and reflect strategically. What is happening around us, and how do we make sense of this for our children and families, for our frontline workforce? Next slide, please, Rachel. So there are some key components that help us navigate that. We're going to think quantitatively. What do the numbers tell us as we analyse need, as we analyse gaps? What is it that we see? Where are our risks there? But we're also going to think qualitatively. What is the experience of our children, of our young people? How do we really understand what it feels like to walk in their shoes and try and access some help and support, particularly preventative help and support, ages 0 to 25, remember? That relies on a relationship of trust. And it also relies on us being able to ask some really honest questions right from the outset. Who are we reaching? And we'll be doing brilliantly in all kinds of ways, reaching particular groups of children, young people and families. Who are we missing? Who aren't we reaching? Who aren't we reaching? And why might that be? And where's the partnership potential? As we look at the landscape, we'll take notice of what is changing. Changes around special educational needs and disabilities SEND. Changes around maternal mental health system. Massive changes happening right now. Local transformation planning to significantly change mental health provision, particularly for children. Our children's partnership is likely to be doing a great deal post-COVID in response to children's needs, particularly in children in need and child protection and children in care. How do we bring these together? How do we build on what works? Innovation, creativity. Let's keep an eye to what is our impact and what does the evidence tell us. Next slide, please, Rachel. So let's just unpack what are these integrated care systems. It's fine to say, you know what, I'm not sure I really understand what these are. So integrated care systems have just entered into a new phase of being. They've got legislative footing now. They've got a statutory footing to enable them to come into fruition, to start to exist. Rachel, please do bring up all the bullet points on this slide for us. So they bring together commissioners and providers. So for a minute, just think health economy. You'll probably be aware that there's been a bit of a kind of hierarchical arrangement going on. I am commissioner. I tell provider what will happen, how we will support children, young people or adults. And it's been quite hierarchical, which means it hasn't necessarily worked quite as effectively as it might have done, because we haven't been able to bring minds together equally to say, what do we all see? What might we all do? These arrangements level that playing field. Commissioners and providers sit side by side together, designing together. That's the whole intention behind some of this system. Crucially, partnership leaders have equal importance. This is not about health economy leaders, everything from general practice to hospitals to pharmacies to mental health trusts, all of that suite and more, sitting in an island. It's about our shared strategic leaders coming together, including local authorities as a key statutory partner, collectively planning, collectively commissioning. So family hubs are immediately relevant in that context. These systems are required, these integrated care systems at senior leadership level are both required and permitted to think much more strategically. And they're given an objective. Let's break down those divides between what has been social care, early help, and health economy. Let's bring them together. Let's think together with our local authority children's services leadership about what are the needs, what are the risks. Public health information comes into its own in this context. Really, really useful. But we'll talk about how we can add to that to make it more detailed and more responsive to what's happening now, because sometimes that's a year or two out of date. It also is a requirement of these arrangements to really listen to children. For the first time, we've got a real emphasis on children, young people and families as crucial in these arrangements. Now that's important because we've just not had that in the same way before. This is a brilliant time for children's services leadership to come to the table and help. This is what we're already doing. This is what we need to do. Here are our gaps. How together might we do this? There's also something very, very important in the design of these arrangements, which talks about a different kind of leadership. Really understanding what's the journey for individuals through the system, not big bulk contracts, millions of people. Overall, how many did we see? Was anybody any better for it at the end of it? Individuals, what are the outcomes for people? But crucially, how are we going to lead? There is a requirement for us to be compassionate in leadership, and that matters. There is a requirement for us to be diverse in our leadership, and that's essential. So it's not just what are we going to do, it's how are we going to do it. And for the first time, an accountability to say, show me the impact. Show me what difference this has made to individual children and young people, groups of children and young people, in a way that in a local authority context we've been quite familiar with for a while in terms of Ofsted inspection requirements, particularly how we make best value of very, very tight resources. This becomes a whole system imperative. And you'll see at the bottom there's different levels of decision making: neighbourhood, place, and then whole system, depending on the numbers of people in your local area. And so for a whole system, you're looking at between 1 and 3 million population for these arrangements. Next slide, please, Rachel. So here are the strategic imperatives that are in the guidance for integrated care systems that really link to what you're doing with family hubs. This is helpful to kind of be able to walk into the conversations knowing that these are your touching points. So the first is there's a real emphasis on prevention. That's important. The demands at the top end of the system, I don't think have ever been higher. So much crisis, so much intense need, but a requirement in these arrangements and a will in these arrangements to work preventatively. So that opens up spaces for family hubs to be core in thinking about parks and sports and leisure and culture and youth and early help from a children's services perspective. There is an interest in broadening the partners who are getting involved and a need for that. Statutory partners can't do all of this. There's significant new money coming down through integrated care systems. So voluntary and community sector partnership, family support are really key in this, but in partnership with our VCFS sector, voluntary community faith sector. There's also an overt commitment to the perinatal period, knowing how important those first 1001 days are. That links directly to what we're trying to achieve with family hubs and Start for Life. At the other end, recognising our 0 to 25 remit, there's also a specific interest in children's social care and youth offending, and then how that integration with mental health support might come together. Again, this is whole system change that is directly relevant to how the family hubs in your local area work with other services. So there's loads of places where together with ICS leaders, we can be saying, how might we do this? Next slide, please, Rachel. So if you were to think about it conceptually, the common language of thrive and I thrive is particularly helpful. So Thrive and I Thrive were developed by Anna Freud with the Tavistock, UCL and Dartmouth partners as a way of starting to conceptualise the system differently. And you all have seen in lots of local transformation planning, for example, that this is a kind of core framework that people are often using. This is helpful to give us a common language when we come together in integrated care systems, and you'll hear this fairly frequently in these conversations. It starts with, what does it mean as a child, young person and family to get advice in the first instance? You can signpost to help and support that's available to enable families and children and young people to be able to respond to their own needs themselves without necessarily needing additional support or knowing where to go if additional support is required. The next layer is getting help. So really starting to think about, what does that first level of holistic support look like? And family hubs are crucial in these two segments. How can you get help? What does it look like? How available to you is it? How integrated is it? How outcomes focused is it? And then there's more help. So actually, when you're getting into a more targeted intervention space where there's a lot more support required, how does that work together? Building a seamless system, often longer periods of time of treatment or support. And then at the top end, what does risk management and crisis response look like? Recognising that our children, young people and families journey through oscillating needs. They can be in 3 places at once. So rather than trying to linearly define, you're in this place right now and this is what you get, this is who's responsible, it's not me, it's them, it's starting to think about how can we develop an integrated system that puts a child, a young person, a family at the centre of what we do, breaking down those divides. Family hubs are designed with exactly this ethos behind them. ICSs and local transformation planning is moving towards this model. So we're talking the same language, and what you'll often find is this language being used in those conversations. So do take the time to have a look at it. If you want help with this, let us know. We can walk your leaders through it if it's less familiar to you. I'm sure it'll be familiar to many of you right now. Next slide, please, Rachel. So let's look for a moment at local transformation planning, LTP planning, which I've indicated a couple of times already. This is important to recognise right from the outset, and you'll see this written into a lot of our Family Hub resources and modules. When we say local transformation planning in a children's context, we're talking about mental health transformation. This huge additional investment of £500 million initially for mental health improvement for children and young people, and then additional expansion, 79 million just for preventative support for children. You'll have seen some of this in things like mental health support teams in schools and other lower level counselling and therapeutic support. This is where a lot of change is happening. Each of your areas are required to publish a local transformation plan. Those strong plans have been co-designed by health economy, CCG and health provider, mental health provider, and local authority leadership teams. We've designed them together, listening to children. Have a look at what your local transformation planning is saying is going to be the next set of changes, priorities, and investment for children and young people, because an awful lot is happening in this space. There's a lot of new money coming into the system for children's mental health. If we're wise, we would think strategically, how do we put local transformation plans alongside our design for family hubs? How do these two things come together? recognising the significant rise in emotional health and mental health need for our children and young people, which is doing this. And post-COVID, the rising crisis, eating disorders, and other more complex needs. So think about, okay, how much money is going into the system for our children? How is it going to be used? How does that link to what we want to do for family hubs? These plans are really open and transparent. They tell you exactly what the money looks like, exactly how those plans are developing. They are also required to give attention to particular key lines of inquiry, so Chloe's, which includes things like, how are we going to support a greater preventative offer? How are we going to focus on those children who might need more or something different from us? Crisis, eating disorders, those children who've been disproportionately affected by COVID, children in care, children in need, children in poverty, and children with protected characteristics of other natures. So we'll get onto that in just a minute. But that is clearly described in local transformation planning. So it gives you quite a lot of intelligence that you're going to want to work on together with children's mental health commissioners, who will often sit in CCG arrangements and will move into integrated care systems, integrated care teams. So let's move to the next slide, please, Rachel. Very simply, what we're describing is that you can't separate out what family hubs are doing from these three areas: mental health, special education needs and disability, safeguarding and protection in children in care. We need to come together in an integrated and holistic system. And this is giving you the tools to say, where do I go and what do I look for? And if you would like us to, we'll come out and help you to do this thinking. I'm going to challenge you now to think a level deeper too. On the next slide, please, Rachel. One of the key things that we must do is think about the disproportionate impact of the last 2 years of COVID. And that's really crucial for the design of our family hubs. It's also really crucial for the systems transformation happening around you that will influence and affect what you want to do with family hubs. We have more children than ever living in poverty, more families than ever who are having to choose between heating their water or their house and feeding their family. We have more children than ever living with the experience of social exclusion, prejudice, discrimination, because of a protected characteristic they live with. It's part of their character, their nature, their identity. It is not okay that in UK society we have a disproportionate impact on our children with diverse ethnic and cultural heritage. It is not okay that our LGBTQ+ community are experiencing increasing prejudice, discrimination, and harm. It is not okay that our neurodivergent and our children with SEND are finding it harder and harder to find a place that feels like a home in schools and in society. We need to think deeper. We are also corporate parents together for children in care, and of all the groups of children that were so adversely affected in COVID, our children in care were. Those children have been through enough already. We take them into a set of arrangements to safeguard and protect them. And then for many, their access to emotional health support, mental health support, and other support was really challenged in the COVID window. And many of us worked very, very hard to try and address that, including the design of national children in care arrangements. So as you're thinking together, think deeper. Look for those children you won't see unless you ask the right questions. What is it like for them? How does that inform our strategic planning and transformation? Next slide, please, Rachel. So in the influence of integrated care systems, we'll be asking ourselves a few questions. Who's on your mental health board? What are the links then to local authority, intelligence, need, risk, gaps in service? Many of you will know the answers to that immediately, some of you won't. Where's the children's board? How do family hubs then fit in that strategic conversation? What are the opportunities to join things together and make best value of what we have? How are we going to strengthen the preventative offer? How are we going to strengthen a nuanced support for our more complex children? Where is the lived experience of our children and young people when we're having these conversations? And how can we get involved in other parts of planning that are relevant, including local transformation planning? I've included here some evidence on the economic case for prevention, how much of a difference it makes economically and to the outcomes for children and young people into later life and adulthood if we get these things right. If you want more of this, please let us know and we can give you some more of that detail. I'm signposting the excellent work from Early Intervention Foundation below here so that you can access that. It's really helpful to take into conversations with ICS leaders. Next slide, please, Rachel. So here are some questions that you might want to ask when you're sat with children's commissioners, transformation leads in your integrated care systems, your ICB, your board arrangements, or in other kind of working group arrangements within your ICS system. What's the money that's being invested here? I've chosen children's mental health as a good example. There are other broader children's questions you might want to ask. How will that investment, whatever it might be, increase the number of children who are receiving preventative support at the first sign of difficulty? You need to know what that's going to potentially look like to design family hubs effectively. How much will meet the other end, children in care, children with complex needs? How's that going to support into adulthood? We're thinking 0 to 25 here. How have we changed what we're doing in response to COVID and to what children are saying they need? How are we going to kind of manage those risks and how are we going to mitigate the level of need and pressure in the system together? How will we know if we made a difference? What's the impact going to look like? So these are just example questions. You'll have a host of 20 or so questions, I'm sure, but as a foundation, if we can all answer these questions, we've got a clear understanding emerging of what's happening in our system. Next slide, please, Rachel. So as we're answering these questions, one of the things we'll be doing is triangulating the information that we have available. And you'll have noticed, as we've talked together this morning, part of what we're describing is we're bringing the voice and experience of children and young people together with what we would see as routine data gathering and analysis, and what we might describe as more populational prevalence data that you'd be used to seeing coming in from colleagues like public health. And putting the three together, I'm just going to give you a little bit of an illustration of how that can work, so that you can visualize that if that's helpful to you. Next slide, please, Rachel. So we're used to receiving big public health analysis. Joint Strategic Needs Analysis, JSNA, is a good example of that. You'll probably be quite familiar with that. It's produced for every local authority area on a regular basis. What it will tell you is overall for your population, on average, how many people will have particular types of needs, what poverty is looking like. Those figures are carefully cleansed, so they're often a year or two behind your current picture. I just want to demonstrate how that overall picture, whilst being very helpful, can also be misleading if we don't ask the deeper questions that we signalled earlier. You'll see a little graph on the bottom right here of young people who are experiencing emotional health needs based on prevalence, so based on kind of the national estimates of what the level of need is likely to be. If you look at the first slide, you'll see what the overall picture is generally like for the country, but you'll see actually, if you're female rather than male, so you identify as female rather than male, your increased odds are much, much higher. So if we just say how many children might have emotional health needs, and we don't say what might that look like for people who identify as female, people who identify as male, will be missing the more significant impact for people who identify as female. As you work down the list, you'll see there's quite a difference depending on ethnic and cultural diversity too. As you look a bit lower, you'll see if you're in year 9 versus if you're in year, based on your age, stage and development, there's likely to be quite a difference there too. For our children with special educational needs, there are increased odds again. If you're living in poverty, you're eligible for free school meals, your need is likely to be higher. If you're a child in need, your need is likely to be higher too. So these are just some examples that say, when we ask ourselves these questions, we need to think more deeply than the overall prevalence rate for our population, which public health will be able to give you very quickly and very easily. So put alongside it what qualitatively you hear and you learn from analysis, audit and listening to children, young people and families. Next slide, please. So our next kind of quartile then is really listening to the voice of children and families and putting those two things together. Next slide, please. Part of what we do in our resources for you, and we can do by coming out and working with your systems leaders directly, is really give you a framework for how do you effectively move from a consultation, starting to ask questions of children, young people and families, which we're quite familiar with, to participation and co-design, to providing opportunity for influence. We have a planning checklist which has been co-designed with children, young people and parents and carers that we can help you navigate through and put together with your analysis of data, also drawing on what we know from research. So if that kind of support is helpful for you, let us know and we'll come out and do that with you locally. Next slide, please. So just to give you an example, this is an example from Manchester, from Be Well, which has been a pan-Manchester analysis which has brought child voice, prevalence and research together. And we've been one of the partners working on that. You can start to do a very, very detailed mapping that enables you to say, okay, by ward, by super output area, what does this look like for our children? Here's one example, which is looking at one particular feature for children and young people. You can do this by feature, need and characteristic. And that really helps with the design of your family hubs. It's also exactly the same task as your ICSs are doing for their analysis of transformation of your children's system. Why not bring these things together? Next slide, please, Rachel. So in family hubs, what we're really doing is bringing to the table the emphasis for prevention, risk and protection. So really starting to say, how can the system work together? And these are the kind of partners that we're thinking about in all the work that we do. Continuing with this example of Be Well, I'll show you what this starts to look like when you then start to break down the evidence of what does it look like to start to bring together support for individuals in communities and families and professional support. What difference can we start to make? On the next slide, you'll see an example of what this looks like. So here's your kind of average experience for children. The more risk you're exposed to, the more likely you are to experience adverse outcomes and for life just to be harder. It's not a predictive model, but based on the balance of probability, that's much more likely to be your experience, not just in childhood, but as you grow into adulthood too. Now, have a look just for a minute at the green line. This is evidence from children and young people who receive targeted family support, community support, and specialist support where they needed it from services. These children all had comparable levels of risk in their lives, but the green line had 6 or more sources of protective factors in their lives. A preventative support that was there to help and support them, from relationships of trust with significant others to low-level emotional health intervention, So 6 or more of those sources of support, you'll see how much that helped to start to mitigate the risks in their lives, in their experience of childhood. And then that gives us a model of what it's going to look like potentially into adulthood. So as we're designing family hubs, as we're talking with integrated care systems about how do we best do this, we've got an eye to not just what are the risks, the needs and the gaps, we've got a constant eye to how do we maximise protective characteristics? How do we mobilise schools? How do we gather supporting communities? What's the role of significant others? And how then do our services complete that picture? So it's just thinking in a measured and careful way in our design of family hubs, which is exactly the kind of thinking our integrated care systems are wanting to embark on. Next slide, please, Rachel. So what I'm describing as an ecological approach to prevention. No one support system is going to be enough on its own, and that applies to family hubs as much as it does to integrated care systems. Every time we're doing this transformation, we're thinking about the individual, the interpersonal, what does social relational support look like? What then is the organisational support? How do our communities raise our children? How do we gather and support our families? And then the role of public policy and family hubs is a really good example of that. We are layering out our design and intervention and support. Next slide, please, Rachel. So, in summary, what we're talking about is as you're setting forth your aims, as you're starting to say, what is it we want to do? What difference do we want to make? What impact do we anticipate? We're not just doing that in a family hub space. We're starting to think about that in an integrated care environment where there's transformation happening around us that can really help with improving outcomes for children. In order to have these conversations well, we want to talk about the risks. How do we see the world together? How are we going to mitigate these things? The financial contributions, what our governance is going to look like. We'll have a family hub design and transformation governance arrangement. How does that link to your integrated care board? How is that front and centre for children and young people's transformation? As we start to look at our practical arrangements, you may well find there's synergy there. We can be working together for other aspects of transformation. As we're designing our agreements, we could be bringing these things together. And ultimately, what we're all working towards is improved outcomes for our children, young people and families. We'll be more coherent if we do that together, both for children, but also for our frontline workforce. Next slide, please, Rachel. So I think, as I said at the outset, we are really, really happy to help you with these conversations. If you think that would be useful, here's some quotes from other senior leaders, both directors of children's services and NHS leaders for whom we've gone out and done this work. You'll see on the little map just how far and wide we work supporting and brokering these conversations both across country and also across the world. So we're here to help you, of course, bringing the National Centre for Family Hubs role at the front of what we do, but also bringing all of those other experiences as an organisation, children's mental health and system transformation, to this conversation to support you. Okay, next slide. So that's it from me. And it's now, I think, some time to just pick up questions or comments that you might have. And I think Julia will come back and join us.
Thank you so much, Andrea. And yes, I invite anyone to pop anything in the Q&A function, any questions or comments that you might have. But I wanted to start by asking you, Andrea, just a bit about, you've been doing these sessions with directors of children's services and systems leaders, and just what you've been learning through these, any reflections you have about the key challenges and opportunities and what this means for joining up these two agendas.
Yeah, it's a good question, Julia. I think the first thing to say is that the level of change that's happening simultaneously in the system is not insignificant. So when we talk about lots of transformation happening at once, we're not kidding, are we? There's a lot happening. So there are challenges with trying to coordinate this and particularly make sense of it and use these precious resources that we're receiving one way or another to improve outcomes for children. And in that challenge lies the opportunity, really. I suppose the other thing we've been really privileged to just sit alongside is where those conversations really start to broker what has felt quite separate sometimes. So health economies felt over here and local authorities felt over there, and voluntary sector's been trying to broker in the middle. Really bringing people together in one room for a few hours and saying, okay, so how are we going to do this? Where are we now? What's working? What can we build on? Where are the gaps we really want to respond to? And where will we start with that list? And then where do family hubs sit in the middle of that, which is often a very pivotal role.
Yeah, and so why do you think the Anna Freud has been at the table as part of these discussions? Like, how do you think that's been helpful for local areas?
I mean, I think probably I'd refer you back to the feedback that we've had from local authority lead members, NHS ICS leaders, to kind of reflect that, because it's for others to say rather than for us to say probably. But what people describe to us is having somebody neutral in the room who's not one side or the other, that can hold a conversation that focuses on children's really helpful. Having somebody who sits in the middle that can translate the language sometimes, so we can talk almost at odds without meaning to, just because we've got a different framework. So the Anna Freud Centre works very easily across both of those systems, and also bring the evidence base. So sometimes when you see so much, there's so much you could be doing, you think, well, where do we start and how do we best approach this? Really looking at what the evidence tells us is most effective and what children say they need is what helps us the most to navigate that transformation.
Thanks. We have a particular leadership role around asking about equity, diversity and inclusion here in the National Centre and Anna Freud Centre more broadly. And I was just wondering what reflections you had on how this is featuring as part of these discussions.
Yeah, so we've worked really hard, as so many systems leaders have, to think about what is a disproportionate set of experiences and impact for our communities, and particularly children and young people with very different protected characteristics or with different sets of needs and experiences. And because of our co-production, we have a lot of children and a lot of parents and carers helping us in our design of everything we produce. We have the opportunity to think quite deeply about that. What we hear from government particularly, and now we're chairing actually a pan-governmental advisory group which brings all the government departments together around children and young people's policy development and transformation, is that our thinking has gone to a kind of quite a deep level in a way that really supports government to think more congruently about this in policy. But also our advocacy then for those who are experiencing adversity, exclusion and harm is really important. And I think that there's nothing we can say more strongly than this is a core component of what we all need to do in family hubs, which must be a welcoming space for everyone. And in order to do that, you need to understand the life that sits behind the child, young person and family that walk into experience of relationship with you. So what sits beneath that, what they lived already. And we don't do that sat on our own. We do that in partnership with children, young people, and with parents and carers who have lived those things.
Thanks, Andrea. We've got some questions coming through now, and one of them is just around, whether trauma-informed approaches are being considered.
Yeah. So everything that we do is considering trauma-informed practice. We have what you might describe as a world leader really in our family trauma provision in Anna Freud. You'll find that in much of the family hub material we've already produced, and in our workforce development materials, so our training materials for multi-professionals across the country working with children and young people, and also with parents and carers. So yes, it's absolutely crucial. What we respect is that there are different practices, frameworks, different frameworks for professionals in different areas, and that for some, trauma-informed is right at the heart of that, and for others, trauma-informed thinking is more peripheral, and we need to work agilely with you, depending on what your approach to that might be, but you'll find it in everything we do.
Thank you. And someone has asked here, are we considering a starting point of what makes us, children, young people and families, well?
What makes children, young people and families well?
Yeah.
Okay, so I suppose just kind of reflecting back, the importance of protective characteristics in our life experience is really important. So yeah, in the design of all of the materials, you'll see us describing what makes the most difference to children. And children are really clear, and families are really clear about the importance of relational practice to them. In order to make any change, in order to tell you what life is like, in order to begin a journey that says what could be different in the future, we need to feel like we can talk to somebody we trust.
Yeah.
Somebody who really listens to what we say and will really consider where we've been, what that's felt like. So the hub of this often kind of rotates back to relational practice. But the emphasis here is to say who is significant to you, and what could the good things, the assets, the protective factors in your life look like to really enhance your quality of life, not just now, but for the rest of your life too. So the foundation we lay in childhood is really important for the ease in which we experience adulthood.
Someone else has asked just about the wider determinants of health and how the system is supporting these wider determinants, for example, impact of homelessness and poor housing on mental health.
Yeah, and those are the crucial questions that integrated care systems are wrestling with right now. And that's why that dialogue is so important, because we know, take housing as an example, if you're living in insecure housing or you're homeless, just returning to Maslow's hierarchy of needs, you need to feel safe, you need to be fed, you need to have a roof over your head that feels like it's stable before any of the rest can change towards self-actualization. So that's our foundation, and integrated care systems have an opportunity to start to influence all of that. And family hubs are a microcosm that, again, wants to start to say, how can we start to change these things? Employment, housing, all of the other wider determinants that are so relevant.
Thank you. And I think you've sort of started to answer this question, but somebody is asking just whether you had any learning or reflections about what some of the challenges that local authorities have faced in coordinating the family hubs work with the ICS in these very early stages of development, which I guess we're very much still in.
Yeah, and what we've picked up is that in our kind of regional and sub-regional workshops that we've run, is that different ICSs are in really different positions around this. So the good thing is everyone's interested. You won't go anywhere where people don't say, I'm not very interested in family hubs. What's the point of that? Everyone's interested. So you're pushing at an open door. What you might encounter is different levels of understanding and familiarity with children, young people and families, and the pressures on the system and what children, young people and families need. So we talk a lot about patience and persistence and compassion in those conversations as a way of just working with each other to build a shared level of understanding as a first foundation. But the welcome from ICSs to say, this is important, we really want to look at this, let's see how we can make our transformation more consistent and equitable. It is there no matter where you are in the country.
Right, well, thank you very much, Andrea. We're coming up to 1 o'clock, so I just wanted to thank you very much for taking the time to join us, to thank our training team who's been helping here in the background today, and everyone for joining on your last day of work before the bank holiday weekend. Just a reminder that you'll receive the slides and a follow-up email after the event and a feedback form. We'd really welcome your feedback about how you found today. We're just testing out these bite-sized training events and really want to make sure that they meet your needs. If you're interested in finding out more about what we're doing around ICS consultancy, we'll share a link to our website in the chat now. Please do head over there. And yeah, a reminder again, our next events coming up are our Infant Mental Health Awareness Week bite-sized training on the 15th of June, and our next National Centre for Family Hubs conference on the 8th of September. Please do sign up to our Family Hubs in Mind Learning Network if you want to receive information about future events and resources. And have a lovely afternoon, everyone, and a great bank holiday weekend. Thank you.